Hello, my name is Grazia Aleppo. I'm a professor of medicine at Northwestern University, but I'm also the medical director of the Diabetes Education Program at Northwestern Medicine here in Chicago. The Diabetes Tune-Up Pathway is a program that was developed as a multidisciplinary program to involve care coordination, pharmacy, educators, diabetes and dietitians, and the endocrinologists to assess the need of patients with diabetes type 2 or even type 1 who had an A1C above 9% and had some challenges in their care. The Diabetes Tune-Up was born as the understanding that when a patient has an A1C that is above 9%, the patient has a lot of challenges. And even though the primary care might feel that they are able to treat the patient, they require a team approach to take care of them and bring them down to glycemic targets. So the way that patients arrive in the program is very simple. The primary care provider identifies that the patient has an A1C above 9%. And so that is the trigger to the consultation to the tune-up pathway. That also starts a consultation to the care coordination who addresses this issue with the patient and contacts them, see if they're willing to participate, hopefully so. But when they do intend to participate, they try to address the various challenges the patient is facing, whatever they might be: socioeconomic status, access to medication, access to good food, food deserts. Sometimes we also have those challenges. When you already assess the patient at that level, you can understand maybe why they have not been able to achieve a better hemoglobin A1C of target. It should be less than 7%, ideally. So when you approach the patient that way, then you can find out what are the challenges and the obstacles. And then you go to diabetes education, of course, which encompasses all of it, and the patient really gathers so much information, so much confidence that they can really achieve the glucose goals. And then at the same time, if there is a need to adjust medication, to change the regimen, the endocrinologist is also involved, and that's how we participate in the tune-up pathway. So during the tune-up pathway, we offer a lot of services. I was mentioning before, the patient will usually see the diabetes educator, and that's when things become really go in depth. So the educator not only assesses where they're at, their status, their understanding of diabetes, but also to understand better the glucose level. Very often we offer what we call a professional continuous glucose monitor, or CGM. And why is this so important? Because the patient might not be checking the glucose very often, and usually when they have A1C that is elevated, that might not be the case exactly. So when patients come up with us without any data, any numbers to show us, doing a CGM gives us so many data points over 10 days. It's about 300 points per day of glucose. In fact, 288 to be precise. And so with all the data, we can discover what are the challenges. Is it a fasting glucose? Is it a post-meal? And if it's a post-meal, it's because the patient has not made the right choices for food or exercise or activity or, whatever there might be, stress. And so we are able with that procedure to really offer a patient cutting-edge therapy to understand not only what's behind the scene, but how to make an actionable intervention to bring the patient to success. So our desire and vision to see the diabetes tune-up for everybody. So we want to expand this tune-up to the entire communities of our colleagues. We started with a pilot program, and we make sure that it worked. And so once it did, we are now expanded to the entire community of primary care providers, so everybody has access to their own tune-up pathway. I'm happy to report that the tune-up pathway has been very successful. We've already graduated 36 patients. And how do we graduate patients? They have an A1C either 7%, which is the goal for the American Diabetes Association, or they're able to decrease the A1C by 2 or 3 %. If you think about somebody starting from 10%, go down to 7%, or 11%, go down to 8%, is quite remarkable of an improvement. I always thought that diabetes requires a village. I think it's true. You need to take care of the entire person. You can't just do a medication and think that it's the only thing. So I want to encourage my colleagues, no matter where they are, to look for the collaboration with your nurse, with any educator, maybe somebody in the community, somebody with an institution you will refer and they can come back to you. But try to engage every single person in your team, however small it is. If a pharmacist at a pharmacy, engage with them to find solution. Try to find a nurse who is interested in doing some education. And so all of this becomes the village and the family of the providers that take care of one person and engage with the person so they can get really strong and empowered to do better with their glucose levels.